Hi, and welcome back to another episode of PainFreeFinally.com. I'm your host, Greg Rollett, here with Houston's senior specialist, Dr. John Trowbridge. And in front of us in this episode is another one of our body parts that we take for granted until we can't use it. We got the foot. We got the foot, we got the toes, we got the ankle.
Exactly.
Boy, the ankle is fun. When you hurt that ankle,
ooh, it's over.
It is over.
You can't find a comfortable shoe because that's not the problem.
No.
You know, there's actually foot doctors. They're called podiatrists. That's how important your feet are.
Yeah, they got their own doctor.
Their own doctor, because if you take a look, that's a bunch of complicated little bones and
That
stuff.
is.
And these are held together by screws and wires and stuff. You don't have those inside.
No, we don't.
You have rubber
At least
bands.
we're not born that way.
You get them later.
Yeah.
Yeah. And the deal is that the complicated nature of your foot is that it's not a pretty picture. It's a walking, talking thing. You go through a mechanical change every time you walk, every step you take.
Yeah.
And so you have a strike and a push off and so on. And in the process, any of those things can be a little rocky, okay?
Yeah.
If it's in your ankle, which is not uncommon because we twist ankles and such.
All the time.
We tear the support structures holding those onto your foot. And then people get what's called plantar fasciitis. Very painful down here because you're stretching and tearing the tissues underneath.
Yeah.
Some people actually have other little problems down there. That's not their worry, it's my worry. It's mine to take care of.
Yeah.
The beauty of this is that, you know, as I've talked before, we stand two-legged, but we walk one-legged. All of these bones are carrying the entire weight of your body through every walking step. Get out of bed, get in and out of the car. All of these things can be intensely painful. What happens is people start shutting themselves in. They start saying, no, I don't want to go to the ball game. I don't want to go to the theater. I don't want to do what? And they eventually stop wanting to go shopping.
They
because
eventually want to stop doing the, I don't want to cook, I don't want to do this, I don't want to be on my feet.
Exactly. And that's the sad part. You can get all the best shoes you want, still doesn't take
Doesn't
care
matter.
of it. Right.
Yeah. So what do we do about it? Right.
Fun part.
As someone who's had major ankle sprains that have put me out of commission for a long time, I know that it's not an easy process. It's not a fun process.
Not at all. And people say, well, that's right, just stay off it for a few weeks. Well, anything that's going to be easy to heal will be in a few days, okay? Anything that's going to take longer than that, you've done a permanent kind of damage.
Yeah.
What happens is you strain these rubber bands that hold everything together, which aren't on this picture.
Yeah.
But you pull them and they start hurting because they're saying, I need help down here. That's the inflammation process signaling your body to do some repair.
Yeah.
And you don't do the repair because these are harder tissues to heal. And you linger and limp and whatever, start taking the drugs. I would recommend you start taking the drugs. All right, good. Next.
Cool. Yeah.
Okay.
What now?
And eventually people end up seeing either an orthopedic surgeon or a podiatric surgeon.
Right.
And they recommend whatever kind of magic they want. Cortisone injections is another favorite one. People do that for all the joints and such. That doesn't actually heal the joints, it actually tears them down. And so the problem is it makes it harder to heal in the future. Stem cells work like a charm. Prolotherapy, reconstructive therapy that I've been doing for many years, works as well. The stem cells work much faster.
Okay.
And they are reliably better because what they're doing is we inject these unique stem cell products in tiny amounts in the spots that are your problem, okay? And they go to work healing you by you.
Right.
You are doing the healing that
You're
they're
naturally
directing.
rebuilding
Exactly.
what's wrong.
Exactly.
Yeah.
And the beauty is that you start to resurface the joints. You actually start walking better. When you're walking better, your knee doesn't hurt, your hip doesn't hurt, your back doesn't hurt, all the way up.
Yeah.
Okay. Because it starts with the foundation here with your foot.
So what can the stem cells actually work with here? Is it just the ankle? Is it the foot? Is it the bone? Like what?
Keep talking.
What are we doing? Yeah.
Keep
yeah,
talking.
which is great. I mean, because again, this is a complicated part of the body.
Very complicated. And I love treating ankles because in all the years that I've been doing it, we reliably win. Now,
Wow.
That's strange to me because these are small bones, okay, for the ankle and the foot, that all the weight is coming down on, and we reliably win on these. We're not as successful with the knee and the hip and such because, there are some problems with healing those areas.
Yeah.
But they're bigger and you'd think, that'd be easier to do. This is the easiest of all. That's the crazy part.
That's incredible. Which,
Yes.
most people when they have that ankle injury, I know I was off mine for almost a year before I was fully recovered. And that's not fun.
No, not at all. I have a water skier that I treated 20 years ago with the prolotherapy, okay?
Yeah.
And he literally had torn his ankle apart crunch the bones and so on. And you know, we treated him with just the reconstructive therapy. Now I would use stem cells and get it much quicker.
So that's what I was going to ask. So someone has this injury.
Right.
They do the fall. They're like me. They're holding their 2-year-old and they slip and miss a step. And you know, the week before Thanksgiving, and your wife's really happy with you.
Oh.
So is this something to come into you know, immediately with the injury? Is this, and obviously also the person that's been injured for 6 months, a year, 2 years, and longer?
Many years. It doesn't matter.
Yeah.
Here's the deal. If something gets over quickly within a few days, you know, 5-10 days, whatever, don't even worry about it. Now, you have stressed the system, and later on we'll be talking.
Yeah.
Okay. But if something is easy and gets better quickly, when it starts taking weeks and then months, oh no, you're past the point. That's when we should be talking about stem cells.
Got it.
If you've been lingering for years, if you've been taking medications, if you've had operations and you're still hurting, you know, have you ever heard of Morton's neuroma?
No.
Okay, well, Dr. Morton described how the nerves are coming down here between the bones, so you can't slam them from the top or the bottom.
Yeah.
And they get a little pinched in the zone there, and they swell a little bit, and then every step is painful. My mother had 3 operations for Morton's neuroma.
Wow.
Stem cells would be ideal for that. Keeps you out of the surgery, gives you fast repair. You're not stuck in the boot.
Yeah.
I'm sure you've seen people in the boot all the time.
Yep.
And the deal is that the repair is pretty easy and the rehab is pretty easy. Go walk. Okay?
I love that.
Now, we're not asking you to stress yourself. You're not going for the Olympics, but just start moving normally, because that's what we want. You know, we want you to repair normally, so you're comfortable and capable.
Comfortable and capable in your daily, everyday
daily life, exactly.
I love that. Now, the great thing is you've set up an amazing website at PainFreeFinally.com, where folks can take this quiz and see if they are the right candidate for this. It gets you the information you need, and they get to kind of describe their problem, and you get to say, hey, you know what? Stem cells is the right treatment for this. Let's get in here.
And the deal is very simple. They don't care what's the right treatment as long as they get the right treatment. They get the results that they want.
They want the result, right?
Exactly.
Yep, comfort in their everyday life. So right now, as you're watching this, if you have that pain and discomfort in your foot, in that ankle, go to PainFreeFinally.com, take the short quiz, answer those questions, and see if stem cells are the right treatment to get you pain-free finally in your own life. Again, PainFreeFinally.com, take the quiz, and we can't wait to see you walking back on your feet pain-free. Finally.